Good afternoon, everyone. I want to apologize about my post yesterday. I had some technical difficulties, but it seemed to have gotten it back together. Today I'm posting on April 1st, 2020. It is April Fool's Day, but there will be no April Fool jokes in this one. Listen to about an hour and a half roundtable discussion with some representatives from New York City. I've been reading a few articles and things like that, and one thing that it is determined is that every effort they're making is to try and recruit more lung so that you can aerate your body better. They're talking about the oxygen going down low, but actually people are tolerating it very well and not requiring any further measures than maybe a little bit of oxygen sometimes, or actually just some inhalers. So that is kind of good news. To that light, I would like to give you some exercises today that I think will help you. They're even discussing that in intubated patients, they're putting them in a prone or face down position because that recruits more lung space. So my thinking is that an ounce of prevention is worth a pound of cure. If we can increase our lung capacities, increase our lung health, then should we get the COVID virus, then we'll be better adapted to combat it and to maintain our oxygen. So to that end, the first technique I want to teach you is, we've shown you this before, is what's called a suspended breath. So it's a deep breath through your mouth or through your nose, whichever one. Take a little sip to expand the lungs more, get the lungs big, hold it for a count of, let's say, 5. 1, 2, 3, 4, 5. And exhale. Exhale it all out, and then hold it out. So what you're doing is you've expanded what are called the alveoli, or the lung oxygen carrying spaces, and now you're collapsing them down, and you hold it out. 1, 2, 3, 4, 5. Now you inhale. You hold them open. Expand them up, open up. If you cough a couple of times, that's actually good because it means that you're opening some airways that haven't been opened. And then you exhale, hold it for 5, exhale, and hold it out for 5. This is similar to a technique, if any of you have ever had surgery, where they give you what's called an incentive spirometer, where you blow against a really, really hard little piece of plastic, and that forces things into the lung and forces the lung to move. The other thing I want to teach you is what's called a flutter breath. It's actually quite fun. And what this will do is it slows the air exhaling from your lungs so that you actually keep the little alveoli open, and then they sort of vibrate a little bit, and then they close. So it's last technique is something called cat-cow, and we're going to do what's called a standing cat-cow. You can also do this kneeling. You put your hands just above your knees, not on your knees, but above your knees, and you arch your back like a cat, like this. And you exhale all the way out, and then you arch your back up like a cow. Hold it up, exhale. Inhale. Once again, working like a bellows to push things out of the lung, get the vasculature of the lung moving, opening the airways, and doing things. Lastly, one thing that's really been determined is that this is an inflammatory process that the virus causes. So anti-inflammatory, such as turmeric, is really, really advisable right now. They are suggesting maybe some melatonin, although I'm not so sure about that yet. I have to look a little bit farther into that. So any of the anti-inflammatories, natural anti-inflammatories that you might want to use, those would be really effective. I will give you a little bit bigger list tomorrow. Tomorrow also I'm going to give you my top 10 movies to watch to kind of get you through this. There'll be some rom-coms, some comedies, maybe some action films, we'll see. But definitely no disaster films. And wishing you all good health, God bless, and goodbye.